We start with the COVID-19 situation here on the local front as the virus refuses to loosen its grip on the country. Ahead of another 3-day long holiday this week, which starts tomorrow, South Korea saw another daily caseload above the 2,000 mark. For more on this, we're joined in the studio with our Won-jong. Welcome, Won-jong.
Good afternoon.
Can you start with our COVID-19 situation for Thursday?
Of course, the number of new daily COVID-19 cases on Thursday remained above 2,000, and due to the post-holiday surge, there were 2,427 new cases, and all but 27 were local transmissions. Of today's cases, more than 78% were concentrated in the Greater Seoul area. As for the vaccine campaign, 55.5% of the total population have now been fully vaccinated.
Now let's talk about vaccinations. I heard that from today, people who've been fully vaccinated overseas can show proof of their vaccination here in the country, right?
That is absolutely correct. A lot of people who gotten their COVID-19 vaccines outside of Korea have found it very difficult to prove their inoculation status when visiting coffee shops and restaurants, meaning they weren't eligible for the vaccine incentives. Kicking off Thursday, though, those who come to Korea with the quarantine exemption document can prove their inoculation status, meaning they are now able to get the benefits of being vaccinated. They can register their information online using apps like Cove at local health centers. And now this will help travelers inoculate abroad and U.S. soldiers stationed in Korea to prove their vaccination status. However, it only applies to vaccines that are approved by the WHO.
Now, Won-jong, we've just heard today that a new kind of side effect has been reported. Can you tell us more about this new kind of side effect?
Right, so it's called the menstrual disorder. Actually, they used to be only 7 items on the list of COVID vaccine side effects. However, the Korea's health authorities are trying to cover a wider range of symptoms now to strengthen the monitor system for COVID-19 vaccination. Take a look at this up on your screen right now. So now we have a fever, a pain, a swelling and redness, vomiting, and headache, fatigue, allergic reaction, and now menstrual disorder has been included.
Thank you for reminding us, Won-jong.
Of course, of course.
Now, authorities have mentioned that their plan to proceed with a living with corona scheme as soon as possible. Now, in order to do that, we need to increase the level of immunity for people, right?
Right.
And I believe booster shots are some kind of possible solution for that.
That is correct. That is actually a good point. Yes, I think so. As you know, the health authorities have started taking vaccine reservations for booster shots for groups who are mostly exposed to the higher risk of catching COVID-19.
Remind us, who again are eligible for that shots?
So since October 5th, those in their 60s and most medical workers have been able to apply for their booster jab. They're getting the mRNA vaccine from either Pfizer or Moderna. To clarify this a little bit more, if you previously got the Pfizer vaccine for all doses, you will get another Pfizer shot. And if you had 2 doses of Moderna shot, your extra shot will also be from Moderna. However, if you are administered with the AstraZeneca vaccine, you will still receive either Pfizer or Moderna.
To make it clearer, so for instance, one person got vaccinated with the AstraZeneca vaccine first on their first shot, and then they got their Pfizer vaccine on their second shot. What will they get next for their booster shot?
Right, so that's actually a lot of people actually question, and actually a few of my friends asked me too. They'll still get either Pfizer or Moderna vaccine, but the booster shot for Janssen has not been decided yet, so we'll see what happens. I would like to point out that research says that the effectiveness of Pfizer's booster shot is 11 times higher for preventing the infection and 19 times higher for preventing severe cases compared to those who didn't have the extra shot.
Now, Won-jong, thank you so much again for your efforts. We will see you again tomorrow.